What would you say to that person that was considering chiropractic care, but they were hesitant or concerned because they're pregnant?
To answer that first part, it's a very common concern that I hear with pregnancies, pregnant mothers. I want to assure everyone it's very safe. There's plenty of different techniques to be used to allow us to treat a pregnant patient. It's very safe and actually very beneficial for the mom and for the baby as they're growing. So I always recommend chiropractic care in pregnancy. The biggest change that we do, obviously a pregnant woman can't lay on her stomach, right? So we have pregnancy pillows that have special cutouts for the stomach. So another way that we change our adjusting approach is I always try not to torque the pelvis too much. The idea behind chiropractic in pregnancy is we're trying to alleviate any pressures that are going on within that pelvis, within the lower back. We're trying to change the tone of some of the musculature, make sure it's not as tight so that the baby can grow fully and has enough room to move around. We change the technique a little bit so that we're not torquing the body as much, so that twisting motion that you might see in some of those other adjustments. I try and keep the spine very straight as we do that adjustment. And oftentimes I'll use the drop table instead. The technique that I employ is through the Webster technique, but it's based entirely around pregnancy and how to adjust safely. And it can even help in some cases of like breech pregnancies. It can help allow for movement of the baby.